Make cancer a chronic, not a fatal disease. That's the dream of founders of the startup New Phase. During his 40-year career, Dr. Arnaldo Sejan has accompanied many patients with terminal cancer.
It's very frustrating for us, for oncologists in general, those patients, because we see the suffering, and we don't have tools just besides giving against pain or treating in the hospice with psychological support or everything that just doesn't prolong life, but that's try to improve the quality of life of the last weeks maybe of life.
It is for these stage 4 patients who have already exhausted all existing resources that New Phase has designed a new heat-based treatment. Cancer cells die when the temperature is above 45 degrees, while healthy cells can withstand up to 55 degrees.
And you can see here, this is iron oxide, okay, they are black. And while put here the magnet, you can see that all the nanoparticles are on the wall. So those nanoparticles, while injected into the body, tend to accumulate on the metastases and tumors, and 4 hours after we inject it, we irradiate the whole body, the torso, and at that time, the electromagnetic field activates or heat up the nanoparticle to a predefined temperature of 50 Celsius. At that temperature, we destroy the cancer cells, which are reluctant to hyperthermia.
It took New Phase researchers 10 years to develop the nanoparticles.
The advantage of a technology that cancer cells cannot develop resistance to it, and we can use it periodically, treat the patient, see if he responds or she responds, and then when the disease is going to progress again, or it's going to show that it's working again against the patient, we can do more treatments without side effects. It's not like chemotherapy. That's the reason that this technology, it's going to be a game changer, trying to bring the patient from the acute illness to the chronic ailment, and with good quality of life.
A clinical trial is underway at Israel's largest cancer center, located in the Beilinson Hospital in Petah Tikva, to test the safety of the product. A dozen stage 4 patients have already received shots at low doses to start with.
First of all, what we learned from that is that the treatment is very safe. We didn't have any life-threatening toxicities. We just have some very mild side effects, and patients tolerate this, and they can get the treatment and just go home. And then we had some signals that the treatment is working in some of them, and so we opened also the possibility of getting new treatments to those that got into the phase 1 study.
New Phase hopes to commercialize the solution within 5 years to treat solid tumors that are resistant to other treatments. If proven effective, this technology could transform the lives of millions of cancer patients around the world.